I am so glad to hear that birth control worked for you and helped you reduce your pain and manage your symptoms. My feelings on birth control exist because of my own experience and the experience of many people who I've heard from personally. And that is this. I was prescribed birth control because they didn't know what was wrong with me and they weren't willing to look into it. It was a Band-Aid solution meant to suppress my symptoms and pain. In my case, the birth control would stop working every 1 to 2 years. I was on birth control for 10 years from age 14 to about 25. And I experienced pretty bad side effects while on birth control that were directly from being on the birth control during that time. What else happened? And this is the part that I have a problem with. This is why I don't think that we should be prescribing birth control to girls who are saying that they're experiencing debilitating severe pain and other symptoms, unless we search for the root cause first. During that time that I was on birth control, the disease of endometriosis was not being properly treated and therefore was spreading and worsening to the point where I had severe irreversible damage and had to have organs removed from my body because of it. Not to mention having to experience infertility, which could have been avoided. Again, I am not against the use of birth control to help people manage and control their symptoms and reduce their symptoms and pain. I am against doing that blindly, and I am against doing that without investigating the root cause. I am also against doing that without giving the patient full disclosure over some pretty horrific side effects that birth control can have on people. And all of this goes also for some of the other hormonal, like GnRH drugs that are used to treat endometriosis right now. If that's right for you, that's great. I do want you to be fully informed so that you can make informed consent on that decision to use that medication. Because the absolute worst thing for me in all of this, when doctors are prescribing pills for serious pain conditions, is that by giving that prescription, you are giving that patient hope. And sometimes that hope that you are giving to that patient, they've waited years or decades even for. And for it to just stop working or to cause all kinds of other problems and for them to never actually get real relief because it wasn't the right thing for them, that's where I have the problem. So I'm not a hater on birth control. I'm a hater on birth control being used for not preventing birth, because let's remember that birth control is actually made to prevent birth. It is not meant to treat serious illnesses. However, it can be used as a pain management, symptom management tool to help control and reduce pain and symptoms. But that should be done under the guidance of a doctor who actually knows what they're treating. Is that so bad to ask for?